Your child has autism. Those are some words that are hard for parents to accept. Because as a parent, the next thing that comes to your mind is, what kind of life will my child have? Or what limitation will he or she have? But the reality is that autism actually has a spectrum. There are high-functioning people with autism who actually have jobs, get married, can take care of themselves. But on the other spectrum, there are also individuals with autism who totally depend on others, including family members, to care for them even when they become adults. So some of the traits associated with autism are difficulty with communication and social interaction, restricted interest, and repetitive behaviors, inability to function effectively in school, work, and other areas of life. And did you know that 40% of people with autism are nonverbal? And nearly half of those with autism wander off from their homes. And this is very important. Did you know that drowning remains a leading cause of death for children with autism? Drowning in water remains a leading cause of death for children with autism. So then you ask, what causes autism? Well, for now, there is no one particular trait to identify as the sole cause. However, research shows that the older a woman is when she gives birth, the higher her chance of her child having autism. Women over the age of 40 are 77% more likely than women under the age of 25 to have a child with autism. Also, stress during pregnancy has been linked to autism development, according to a research at the University of Missouri, Columbia. I actually have a co-worker who has a child with autism, and she believes that it was the stress during her pregnancy that contributed to her child having autism. In a different study, researchers also found that early life exposure to air pollution may be a risk factor for autism. Also, children of mothers living near a freeway and traffic-related pollution during the third trimester of pregnancy were twice as likely to develop autism. That's very interesting. To help your child live the best life they can live with autism, these are the certain things that parents have to do. Early intervention affords the best opportunities to support healthy development and deliver benefit across the lifespan for an autistic child. Early intervention can improve learning, communication, social skills, as well as underlying brain development. Many children affected by autism also benefit from other interventions, such as speech and occupational therapy. In conclusion, it is normal for parents of children with autism to worry about their child's life as adults. The most important thing to do is to start preparing early. Look into early intervention services that will strengthen the skills needed for independent living in the future. Also, start researching the different financial and residential options available in your area. See what government programs are available for your child and apply as early as possible, because these programs tend to have wait lists. For instance, Medicaid covers long-term residential care, which some autistic adults require as they get older. Also, if your child has older siblings that are capable of helping to care for your child as you, the parent, gets older, have that conversation with them when they are old enough to understand that you hope they can help in taking care of their sibling with autism when you, the parent, is not around. So preparing in advance for who will take care of your child if something ever happens to you is a smart move, because it will assure you that your child will be okay when you are not around. Once you have a plan in place, you'll be comforted in knowing your child will be taken care of when you are not there. Good luck. Thank you for listening. You got this.